You can come in.
Good morning.
Good morning.
My name is Elizabeth Sanchez. I'm a first-year medical student from Univer University. May I have your name, please?
My name is Marcos Dominguez.
Okay, Marcos, how do you feel today?
I feel fine.
Okay, so today I will be conducting your abdominal physical examination, okay?
Okay.
So I'm gonna wash my hands before beginning.
Sure.
Upon inspection, you can ask if the patient have eaten recently, if he need to use the restroom, if he feel any pains, and you can ask also about what can you do in order to make him feel more comfortable. You should make sure that properly drop the patient and observe the general appearance, the surface contours, the symmetry, maybe suggest an hernia, large organ. And in the skin, you should make sure if the patient have the right temperature, color, scars, dilated veins, if you see any rashes or striae.
Can you please lie down?
Sure.
I'm gonna cover you now. Can you please uncover your abdomen area?
When auscultating the abdomen, you should place the diaphragm of your stethoscope gently on the abdomen, right on each of the quadrant you're listening to. And you have to listen for the bowels movement and sounds and note if the frequency and character varies. Normal sound consists of clicks and like gurgles occurring at an estimated frequency of approximately 5 to 34 minutes, and it varies in dependence of the area you're auscultating.
When auscultating, be sure to use the diaphragm of the stethoscope. Here, you are listening to the pitch, quality, and frequency of the bowel sounds.
When doing percussion of the abdomen, it's important to assess the amount and distribution of gas in the abdomen, viscera, and masses that are solid or fluid filled, and the size of the liver and spleen. Tympanic sounds usually predominates because of a gas in the GI tract, but scattered areas of dullness from fluid and feces are also common. No any dull area suggesting underlying mass or enlarged organ, in this case the liver, and this observation will guide subsequent palpation.
When percussing the abdomen, you are assessing the distribution of tympany and dullness around the abdominal regions.
Important aspect to take into account when percutting the liver is that you should measure the vertical span of liver dullness in the right midclavicular line, and after carefully locating the midclavicular line to improve accurate measurement. You start at the level of the well below the umbilicus in the right lower quadrant, in an area of tympany, not dullness. This is very important. And percuss upward toward the liver in identifying the lower border of dullness in the midclavicular line. Next, you should identify the upper border of the liver, listen to dullness sounds, starting at the nipple line and going downward. When percussing the spleen, it's important to percuss the most inferior interspace on the left anterior axillary line in a point called the Castell's point. This is usually tympanic. You should ask the patient to take a deep breath, and if it remains tympanic on inspiration, the spleen percussion sign is negative.
Take a deep breath. Breathe out.
When doing palpation of the abdomen, you can do it in two ways. First, a slight palpation that aids in detection of abdominal tenderness, massage resistance, and superficial organs and mass. Then you do the palpation that you use this technique to feel internal organs and masses for size, shape, and symmetry and mobility. You should look for guarding, voluntary contraction of abdominal wall, rigidity, that is the involuntary reflex, contraction of abdominal wall, and rebound tenderness. That's when the patient expresses pain after the examiner pressed down on an area and removes said hand. And it is really important that you make sure the patient has flexed knees during palpation.
Can you flex your knees, please? Okay. Let me know if you have any pain. Let me know if you have any pain.
When palpating the liver, you begin the palpation in the right iliac fossa, starting at the edge of the superior iliac spine, using the flat edge of your hand, the radial side of your right index finger. Ask the patient to take a deep breath, and as they begin to do this, palpate the abdomen. Feel for a steep as the lever edge passes below your hand during inspiration, and a palpable liver edge this low in the abdomen suggests gross hepatomegaly. Repeat this process of palpating, moving 1 to 2 centimeters superiorly from the right iliac fossa, each time towards the right costal margin. And as you get close to the costal margin, typically 1 to 2 centimeters below, the liver edge may become palpable in healthy individuals.
Take a deep breath. Breathe out.
When palpating the spleen, you begin palpation in the right iliac fossa, starting at the edge of the superior iliac spine, using the flat area of your hand. Ask the patient to take a deep breath, and as they begin to do this, palpate the abdomen with your fingers aligned with the left costal margin. Feel for a steep as the splitting edge passes below your hand during inspiration. And repeat this process of palpating, moving 1 to 2 centimeters superiorly from the right iliac fossa each time towards the left costal margin. It is important to notice that in normal, healthy patients, you should not be able to feel the spleen.
Take a deep breath. Breathe out.
When percussing the kidneys, place the ball of one hand in the CBA and strike it with the ulnar surface of your fist. If the patient feels any pain, it's a bad sign.
Can you please sit up? Can you lift your t-shirt? You can pull your shirt back down, and I'm gonna wash my hands. Everything looks normal after inspection, auscultation, percussion, and palpation. Do you have any question for me?
No.
Thank you for coming today.